Vanakkam, Namaste, and welcome to Dr. Shah's clinic. My name is Dr. Shah and I'm a consultant andrologist in Chennai. In this video, we are going to discuss a very common clinical condition that I routinely see in my clinical practice, day in and day out. The condition name is called Dhat Syndrome, spelled as DHAT. We are going to answer three important questions in this video pertaining to Dhat Syndrome. The first question is, what is Dhat Syndrome? So, Dhat Syndrome, the word Dhat has been derived from the word Dhatus as per the Vedic scriptures as well as the Ayurvedic texts on the subject, and Dhatus refers to bodily fluids. So Dhat Syndrome usually refers to a clinical condition where men attribute extreme degrees of tiredness, fatigue, clinical depression, anxiety, impotence as well as a general loss of fertility because of semen loss. Yes. So sometimes men lose semen during their sleep, men ejaculate semen during masturbation cycles or during sessions of masturbation and also during sexual intercourse. And men who develop Dhat syndrome usually attribute experiencing extreme degrees of tiredness, fatigue and erectile dysfunction, especially with the loss of their semen. So semen has been considered to be one of the most precious among all body fluids as per the Vedic scriptures as well as the Ayurvedic texts. Now, we don't really know how common Dhat syndrome is because Dhat syndrome is predominantly culturally mediated. That means it is seen more prevalently in certain cultures. So Dhat syndrome is seen in Indian men, Pakistani men, men who are from Bangladesh, men who are from China. Although Dhat syndrome has also been reported in Russian men as well as European men, but the studies are more scarcer. There are only about 45 to 50 published studies in the entire clinical literature based on this particular condition called Dhat syndrome. Now the next question we are going to answer is, what are the symptoms of Dhat syndrome? Now a typical patient with Dhat syndrome usually comes to the clinic is in the age group of say between 18 years of age and somewhere between less than 25 years of age. So 18 to 25 years of age is where most patients have. About 40% of patients will have or would have experienced some degree of Dhat syndrome, would have undergone some degree of Dhat syndrome symptoms. So common symptoms that patients of Dhat syndrome report include extreme degrees of tiredness, a lack of motivation, a feeling of excessive fatigue. They are extremely anxious. They have rest tremors. They feel nervous all the time, and they feel very, very dejected and down. They feel like life is not at all worth living. They go into full-fledged clinical depression. They also have anxiety attacks. They suffer from severe erectile dysfunction, and they attribute all this to the loss of their semen, which is a very important body fluid. So we really don't know why Dhat syndrome develops among youngsters, but to a large extent what we do know is an improper sex education or the lack of sex education or culturally mediated orthodox belief systems can actually lead to the development of this particular clinical condition. Dhat syndrome has been classified as a clinical disorder as per the recent ICD-10 manual. It's also present in the DSM-4 manual, which is predominantly used by psychiatrists in their diagnosis. But Dhat syndrome is very, very different, and most general practitioners or practitioners of clinical medicine do not acknowledge the importance of the particular condition, and most patients are seldom given the right care they deserve. So the third question we are going to answer is, how can Dhat syndrome be treated? Now, once a diagnosis has been made for the patient, or once the patient has been diagnosed with Dhat syndrome, treatments are fairly straightforward. So patients have to be started on anti-anxiety medication, point 1, also antidepressants, point 2, and point 3, they have to get psychosexual counseling as well as cognitive behavioral therapy, which is called as CBT. Now, a combination of medications along with cognitive behavior therapy as well as sex education or psychosexual counseling usually helps patients recover very, very easily from the particular clinical condition. If patients are, however, not treated, what basically happens is patients suffer even after marriage, and they suffer unduly, which is completely unfair. Now, because there's a lack of knowledge about Dhat syndrome even among the general practitioners, a large number of patients suffer from chronic fatigability and chronic tiredness as well as chronic erectile dysfunction even into their marriage, because they are not educated, they are not told about normal psychosexual development, they are not educated about their own sexuality, and it's more a lack of knowledge more than anything else. and their anxiety symptoms are not controlled for, their depressive symptoms are not controlled for. So Dhat syndrome is definitely clinically very well manageable, and the biggest problem we are seeing today is that large number of doctors or GPs or general practitioners or clinical medicine experts or fertility experts are still not aware that such a condition even exists. So I hope you enjoyed this video on the Dhat syndrome, and please do share put in your comments below. Do like, comment and subscribe, and do share this video with all your friends and loved ones. I'll be coming back with many more videos. Till then, Vanakkam, Namaste.